What's up, y'all? Thanks for checking out the video. This is Not a Real Doc DPT, and no, I'm not a real doc, but I am a doctor of physical therapy that is licensed and practicing for over 12 years. And today we're going to be talking about what you need to know before your total hip replacement. So let's get into it. I've got 5 things that you're going to want to know about. And so you're, especially not the very last one that we talk about, you definitely want to check that one out. But in general, to start off, you should know this is a total hip is normally a highly successful surgery that patients generally experience without too many problems. It also is a surgery that is pretty, I don't want to say simple to recover from, but it can be fairly simple to recover from as long as you kind of follow a few things. So number one, are going to want to know what approach your surgeon is using to have the hip replacement. So typically there are 2 approaches usually for these surgeries. One is going to be a posterior approach where they come in kind of through more through your behind area to do the hip replacement. A second approach is going to be more anterior lateral approach. So that's going to be more kind of from the side to the front. Um, Surgeons, I think, are at least that I see, are tending to go more towards the anterior approach because it seems to be a simpler surgery maybe, although I want to be careful when I say that. But it is an easier recovery, I think, or it leads to an easier recovery from patients a lot of times. But anyway, the reason that you're going to want to know this about your surgery is each of those procedures are going to require hip precautions after that surgery. So the posterior hip precautions that you will have if the surgeon goes in that way are going to be you're not going to want to break 90 degrees bending over. So you wouldn't want to bend over and pick something up, say. You're not going to want to cross your legs across midline. And you're also not going to want to turn your foot inward or do an internal hip rotation. So those are the 3 patterns of movements that you're going to want to avoid after your hip surgery for that. As far as 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 far as how long those hip precautions are going to be in place, that is going to be entirely up to your surgeon. Usually, they're going to be around for 6 to 8 weeks as a minimum. I've had one patient in the past who only had about 3 weeks, and the surgeon told them they could release those precautions after that. I thought that was a bit early, but uh, that's what the surgeon was telling them. Sometimes surgeons have left them in place for 6 months. Occasionally, they'll go out to a year. I've heard also at times where those precautions were in place for the rest of a person's life. Usually, that is reserved for a potential problem that may have happened within the surgery. So. That's rare also. That usually doesn't happen. So that's the posterior approach. For the anterior approach, really the main thing is avoiding real like your leg going into extension. So that may be like just kicking your leg backwards. That could also be taking really big steps. Some other precautions for that generally are crossing over your legs and then also turning your foot outwards. However, that's even become less and less of a thing. It really has been more just the avoiding the extension of that leg that I'm starting to see more and more. But anyway, as to which precautions that you might experience with your surgeon, that's going to be up to the surgeon to tell you. You just will want to know that after your hip replacement, there are going to be some precautions in place. And so you're going to want to ask, hey, what type of precautions do I have? And then your surgeon will inform you as to what type you'll be following. If you're unclear about that, ask your physical therapist, and your physical therapist that's working with you will tell you what those are. So that's going to lead on to a second thing for us to talk about, and that is going to be um, so after, and I mentioned this just a minute ago. So your surgeon, if your surgeon is needs to be given the benefit of the doubt. So your assumption coming out of this surgery is going to be that your surgeon did the surgery and he or she did it well. Okay, it's not just that they did the surgery, but they did it well, and you're going to want to assume that until you have evidence that leads to a contrary assumption or a contrary recognition. Okay, so um, you're going to be experiencing, little bits of pain here with this, but not terribly much. But you're eh, that sometimes may lead you to questioning, hey, did my surgeon do a good job, or did my surgeon do the right thing? Why am I kind of feeling this way? Those are not, you don't attach those two things. You ask, why am I feeling this way? But you don't go and then start questioning the surgeon. You want to assume that the surgeon did their job and they did it well until there's evidence to the contrary. And I'll tell you that I have had a situation before where a surgeon, whoops, I keep hitting the mic, um, where a surgeon actually made a mistake. And I've actually I've heard of a one or two times. One, though, is relevant to this discussion because it was a hip replacement. And I'll tell you, that surgeon was very forthright. As soon as the patient was waking up, the patient was even groggy. They were telling me, as this and or as this the patient, or excuse me, as the surgeon was talking to them. But that surgeon was right there bedside, right as they're waking up, and telling them, "Hey, look, I apologize, but as I was nailing in the pin into the bone, the pin moved in a way I was not expecting, and now you're going to have hip precautions for the rest of your life." The surgeon was very forthright, was there immediately saying, "Hey, this was the problem, and this is what's going to be the result." So that's usually is how it will go if there's been some sort of an issue there that the surgeon's aware of. But otherwise, if you don't have that type of thing occurring, then you're going to assume everything went well. Next thing that you're going to want to know is that you're probably going to be on a walker for 2 to 3 weeks. That is usually, without a doubt, that's not only for safety concerns, but also because it's going to help you to use that leg less. So your leg's not going to work as hard when you're actually walking with a walker. So not only do you have the added stability improvement and the safety of it, but you're also helping to decrease that work that's going to happen to your leg. So then that's actually is not going to be as painful. Speaking of pain, and that's is going to be what we're on the fourth thing, is surprisingly not something that is terribly bad for patients that are having this particular surgery. So you're going to want to know that when you wake up, you probably will have some discomfort and stuff, but most patients don't really complain about pain very much. There's a little bit of discomfort there. There's stiffness there, especially maybe as you're transitioning from sitting to standing. But for the most part, patients generally tolerate this particular surgery very, very well because it's not terribly painful. So you might be able to get away with just taking Tylenol. Usually, the surgeons will prescribe you oxycodone just a little bit, just in case. But a lot of times, patients wind up not even taking it. So it's something that you can expect in this is that it's not going to, for most people, it's not going to be terribly painful. Um, Also, the this usually patients are going to have the Aquacel dressing to the site of wherever the surgeon entered. And the surgeon usually also is going to close with surgical adhesive. So they're going to close with glue. It's done occasionally where they'll close with staples. And it certainly is going to be the surgeon's preference as to which one they use. But I find typically they're using surgical glue or surgical adhesive to do the close. The thing that I was telling you that is really the most important thing that you need to know before your hip replacement, and that's going to be that the recovery for this is primarily walking. Really, walking is going to be your number one thing that you're going to need to do, it's going to be walking with your walker. And as I say, you'll expect to use that for about 2 to 3 weeks, and then you'll go from a walker to a cane, and then you'll go from a cane to nothing at all, if that's what you are using. I mean, if you're capable of getting to that point. Um, sometimes patients might, for balance reasons or for entirely other reasons, they might not be able to get off of a cane, say. But if you were not using a cane before all this was an issue, then your therapist and your surgeon will want you to get back to the point of not using the cane again. So it'll be a process that you'll follow, going walker, cane to nothing. Um, and as long as you uh, follow the orders or that the surgeon has given you as far as your pain medication, as far as your precautions, your hip precautions go, as long as you're listening to your physical therapist and doing the exercises that they want you to do, that you're actually on that hip and walking, then you should have a very successful recovery from this. These surgeries are highly successful, are not particularly painful, and generally lead to very good outcomes. So that is what you want to expect that this will or how this will go. We'll be saying prayers for you that that is the path that your particular surgery follows. And you'll want to check out my video after this, which will be what to expect after you've had a total hip replacement. Also, I'm gonna link at the back of this or at the end of this video the two potential PT options that you may be discharging from the hospital to, which is going to be either to a skilled nursing facility or to home health. And so that those videos will be able to tell you what you should expect for your evaluation in both of those settings. All right, I hope that this has been some good information for you, and hope that your surgery goes well, and we'll catch you next time.